neck injury in the trauma. So we have to look for the two things. One is soft tissue injury and other is cervical spine injury. So previously in the primary survey we didn't evaluate the cervical spine. If only if the patient is stable, in the secondary survey we have to do the cervical spine examination. So in primary survey we just kept this C collar only. So in order to whether to remove the C collar or not, we have this nexus criteria. So N for the neurodeficit, C for ethanol intoxication, X for extreme distraction injury, that is something directly fall on the head, and U for the unable to provide the history, S for the spine tenderness. If any of these things are present, keep the collar in collar will stays and shift the patient to the CT scan for CT spine. If this CT scan is not available, do the bedside X-ray of spine in the AP lateral open mouth odontoid view. If the nexus criteria is absent, so remove the anterior half of the cervical collar, C collar, and ask the patient to move the neck. If pain is absent, then remove the collar. Next, it is soft tissue injury. Soft tissue injury occurs in penetrating trauma, injury to the neck. There will be a breach of platysma may be present. Zones of trauma in the neck, we have zone 1, that is from the thoracic inlet to the cricoid, zone 2 from cricoid to the angle of mandible, and zone 3 from the angle of mandible to the base of the skull. And so if the patient is stable and penetrating injury to the neck is present, if in all the any injury in the zone 1, zone 2, zone 3, we have to go for the CT angio. So in zone 1, if the zone 1 and zone 2, if CT angio turns out to be abnormal, so explore. In zone 3, if it is abnormal, do the angioembolization. Next, in CT angio, if zone 1 is normal, do the contrast esophagogram. If contrast esophagogram turns out to be normal, just observe the patient. In zone 2, zone 3, if the CT angio is normal, just observe the patient.